just come here. Okay. If you have any questions, as always, just let me know. You want to start with the neck or the back?
Neck. Why not? We'll go top down.
All right. So obviously, what's happening in your and what I would say what's happening for you in the neck is very similar to what's happening in the lower back. I just think you're having a lot more mobility issues in that right hip.
Okay.
I know we went top down very quickly, but what I'm saying is in your right side of your neck, in this vertebra and area right around here, is that you can't rotate or bend to the right. Usually the things that do that are the facet joints, right? These are the things that are most prominent when it comes to where chiropractors pop or click. So in theory, you should get better with the adjustments. You should definitely have almost instantaneous type of range of motion increases, and that's probably why you've seen chiropractors in the past, because you notice, and I think that's actually your biggest issue, is that you have loading that's going on excessively on your facets from all the sports and stuff like that. I have tested you for disc-related issues, and are you familiar with that type of stuff? Where, I'm going to show you here, where we get compression to these areas, we can get herniations and things that bulge out the back. I tested you for all that stuff. I tested you neurologically. I tested all this other stuff. You didn't even come up, so why even bother? I'm not even going to talk about it. So you're not getting any nerve pinching, and that's why I'm talking about this stuff.
Okay.
I'm only going to talk to you about what I think is actually happening to you, not necessarily what I think, it could potentially happen to you, unless there might be a little bit of that. So we don't even have to have that conversation. But in neck pain and stuff like that, when I supported your neck extension, when I placed my hand in there and I kind of said bend back, feel like, oh my God, it feels pretty good. That's because we're allowed to kind of allow that cervical curve, with support to kind of come back like that a little bit. And so I think it's just a little bit in your posture. You kind of go forward a little bit. We all kind of do. Yeah. But I think it's adding a lot of load and tension on that area. Most people will say that in the tension up in here, you'll feel a lot of shoulder blade pain, maybe beginning of the top of the shoulder blade, and it'll just feel like it always needs to be stretched out. I think this is one of these muscles, as well as the levator. It goes all the way up and it kind of flips itself. So I do think that these muscles are kind of one of those that kind of create a lot of that musculoskeletal pain that you typically have.
Okay.
And of course, with active release technique or Graston or things that we'll talk about in a second, what we can do with pretty much the soft tissue work, will really kind of dive into not just kind of quote cracking you, but just actually stripping the muscles, making sure not only the joints are freed up, but the muscles are too. So and I usually start with that.
Okay.
So far, does that make any sense? So every single time in that right hip SI joint, if I tested you for a disc issue, which is 95% of the people that come in here, maybe 90%, there's probably about a good 5% that maybe have SI joint dysfunction, which I think you might be leaning towards.
Okay.
But you're not really having that either, because the tests were negative too.
Okay.
What I have just noticed in you is that I think we can kind of tune up some of the mechanics, and I think you're just having a little bit of mobility issue, not only within the quad and the knee here, definitely within the quad and you felt that, with the hip extension too and the hip flexion. Something within the pelvic girdle is just not, if I kind of took this person and I kind of divided, keeps doing that to me, divided this person into, why does it keep doing that to me, into half, some sort of misfiring is occurring either within here and or within here.
Okay.
Now, I would probably say because you have good definition, you have a good lumbar curve and stuff like that. Just I can't even tell you why per se, but I can just tell you by putting my hands on you and watching you kind of go through hip extension and then not be able to do it and then do 3 reps. It probably tells me that when you're exercising and stuff like that, it probably takes you 10, 15, 20, maybe even 30 minutes to actually start feeling good, as opposed to some people it's only 10 minutes.
Yeah.
And that's when you start feeling powerful, is after 20 minutes where everybody's almost gassed out.
Yeah.
You're starting to feel good. I think it's because you don't get the activation,
Okay.
and this starts finally activating it like a lot later. Is that a hip mobility issue? I think so.
Okay.
I don't think there was any direct compression. Every time I was pressing like 1, 2, 3, 4, 5, and then going 1 and 2 and 3, you typically are having something always within
Yeah.
here and within here and within here. This area is not really.
Yeah, I don't
that
usually
big.
have
Yeah.
issues there.
So I personally think that this area is kind of primarily focused right on to that type of glute area. So I think we should release the hips, especially when we're talking about fluttering and stuff like that. Now, what does this all mean for you? The way you really fix back pain is actually, believe it or not, through deadlifts. And I know it sounds like, what? What? Yeah. Because it's not necessarily deadlifts, it's proper hip mobility
Yeah.
and proper strengthening. And I've noticed that just like kind of going through here, you're kind of like jammed and stuck, whereas the other one was like all the way up.
Yeah.
Now, when we bend down, kind of you have good form. I'm going to give you a couple cues and things that I think you should do to help improve your hip hinge. These are going to be a couple of your exercises. And then I'm going to kind of throw a couple of Hail Marys at you and say, hey, I think this one and this one will help you too.
Okay.
Because we got to throw some curves in there and see what you can hit
Yeah.
and what works and what doesn't. Because me just cracking you all day is just going to lead to the same thing.
Mm-hmm.
But we are going to work heavily on, if you get the point.
Yeah.
This thing is just not, every time I hit it. We're going to work heavily on that glute and on the pelvic girdle and also on the neck and stuff like that. So, do you have any questions on any of that? Or any issues or anything like that?
I think so.
So, I'll learn a lot more once I place my hands on there, and I'm going to dive into like the hips, and you're going to be like, what the heck is going on there? And I'm like, actually, it feels pretty good. And then maybe 2 days later, 3 days later, or like the next muscle I thought was quote good, I'm like, oh, this sucks.
Okay.
And you'll find out, and
Yeah.
I'll find out as I work on you. So, any issues?